Hello everyone, this is Dr. Mohid, and today's video is going to be a little different than the usual one. I know by the series, right? So we have to discuss viral infections. That we'll be doing after that. But I guess we have been doing quite a lot of just the basic things, right? Just reading the theory and just going on with the topics and all the details and everything. Yes, so today's lecture I have planned a little bit different. Okay, so today we'll just revise all the topics. Yes, all the topics we did till now. Yes, not after that, till now, whatever topics I thought, everything will be revised today, but not like the one we did last time. Okay, today what are we going to do is I have framed the whole thing in a question answer format. Okay, just like the old school days, I'll be asking you some fill in the blanks, some MCQs, and match the following. Alright, and at the end I have presented 10 cases. Alright, 10 cases which I hope you guys can get it right. If you have listened the lecture properly and if you have read the notes properly, yes, I'm pretty sure your answer will be bang on track. Yes, and you will just glide through it. Okay, and one more thing is, this is not about how many answers you get right or wrong. Yes, it is just about checking that if you are listening correctly. Okay, and all these questions that I have framed, these are from my notes. Okay, and I hope you have the PDF and you are reading them properly. Okay, and one suggestion to all of you, whenever you get some extra points, right? For example, if you are just reading something about Pityriasis Rosea, all right, you had some finding from probably some other place. What you can do is you can just keep on adding things, all right, and make this as a main resource, right? So whenever we are reading something that we are familiar with, so that our brain becomes more receptive, and especially if it is written, yes, and if it is a typed format, it becomes a little different. I'm just sharing my experience. We all are individual personalities. The way we take things are very different, but yes, this method is highly likely to have good results in your and my favor. All right, so today, before starting this, yes, I have made something for you guys, and this is a sheet, right? Okay, and if you have the PDF, you can just annotate on this, or either if you don't have it, absolutely fine, you can just take a piece of paper and just mention these things. Yes, so how I want to keep this paper is like you just add this like as my limitless stars. Okay, all right, these are your limitless stars. Okay, and how many ever questions you get right. Okay, it's not about like how many of them we get right and who is up, who is down. It's not about that. It's about your reward. Yes, that is, you listen to these many lectures and you have retained that information. So the retention is important, right? We can go endlessly about the number of hours about anything. The medicine is a very beautiful and it's extensive. It has no boundaries to it. But how much you retain, that is what is important to us. Yes, so in this I want you to reward yourself. Yes, so how much ever you get it right, so you just mention it like this. Okay, so you just mention the stars. You can just add some stars, right, directly. It is nothing much, not something something I have drawn it just from our keypad, right? It's just an emoji. Okay, so you can just add that. Yes, and probably write in front of it that how many stars you got. It is a reward function to your brain. Okay, all right, so this will create a good memory. The everything is being structured that you have a good memory. Yes, okay, all right, so that was a good introduction about this. And this separate PDF, like for the single page, I have provided as well. Okay, so you can just download that and use this as your reference. Okay, so let's start. So we just start with the first thing. Yes, so what I'm going to do is, rather than just giving you time for doing it, what I'm going to do is I'm going to play a timer. Okay, because yes, definitely, probably some of you are been preparing for competitive exams, then there's always a timer running in front of our head. Yes, so our brain should be trained that way. Yes, so whenever we give our GTs and all those things, the timer is running, right? So I want to do that, but I'll not hurry up. I will give probably 30 seconds. These are very short questions. Probably while 30 seconds or 20 seconds would be quite enough to answer them. Yes, so the first session is about basics of dermatology. Alright, we went in excessive greater details to this. Okay, fine. I'll just put up a timer and we should just start away. Okay, fine. So 3, 2, 1. The largest organ of the human body is. It's pretty simple, right? So what would be the answer here? I'll start highlighting all the answers which are there. Okay, so it's definitely skin, right? Because we are reading dermatology. Okay, fine. So coming on to the second one, right? So what is the epidermal turnover time? Okay, so what is that? Tell me. Okay, so I hope you have not made any sort of mistakes. Yes, so and I hope you don't have the answer 4 in head, like, okay, fine, it could be 4 days. Not like that. I have not mentioned psoriasis. Okay, this is just a normal finding that I'm asking you. Okay, so that is the range we read, right? 56 to 75 days or 72 days. Okay, it is a range. Question number 3. Stratum lucidum is present in what? The answer is B, right? Palms and soles. Okay, we go on to the next one. Melanocyte origin is from what? And this is an INICET question. Okay, melanocyte origin is from what? The answer is, these are one of the neural crests, right? Neural crest cells, they have this origin. Okay, I know these questions could be like very extremely simple, but when we are sitting under the fresh cooker scenario in the exam, right, so we just get these sort of questions wrong, and this is where all the mayhem happens, that 149 and that that just 1 mark, 2 mark, these are the questions which define that, because if we get this wrong, then the whole everything we just scattered. We cannot afford to make these questions wrong. Yes, the next one is, Langerhans cells contain which granules? Alright, so these are the Burbeck granules, right? Okay, tennis racket shaped Burbeck granules. Okay, how about the next one? Filaggrin mutation is associated with what? Nobody can say that these topics were not taught or it is not included. Everything is from the notes. Yes, so if you are thinking psoriasis, the answer is wrong. Yes, so the answer is A. Okay, so it is atopic dermatitis. Alright, how about the question number 7? Basement membrane weakest zone is what? So we read about the whole diagram. Yes, there was a huge diagram. Yes, in that we had lucidum. Yes, somewhat. You guys remember? Okay, so it was this lamina. It had 2 parts, lamina densa and lamina lucida. Alright, it was that. So I hope you guys remember that diagram I drew. Yes, it was quite extensive, and all those anchoring fibers and this and that. Okay, alright, the next one. Keratinocyte strength increases due to what? Elastin, huh? Elastin is the answer. No, right? Obviously not. Yes, so it is filaggrin. Filaggrin is the answer, right? Filaggrin is the one who is making all the the tensile strength. If you remember the diagram, all those things which was giving a strength to the keratinocyte was filaggrin. Okay, all right. One more question. Not in this, but I just want to generally ask you. Yes, so in bullous pemphigoid, antibodies are made against which? Yes, if it is BP1. Yes, so where is the BP1 placed? Is it inside the hemidesmosome or outside the hemidesmosome? The answer is, it is inside the hemidesmosome, right? So the 1 is inside, 2 is outside. So if you remember, yes, so there was this hemidesmosome structure. Yes, and in that I drew something like this. Yes, so this is 1, and the BP2 was the one who was the projections which were coming from the hemidesmosome. These are the BP2, right? And in bullous pemphigoid, there are antibodies against this. Alright, the next one is the laminar bodies produce what? Laminar bodies produce what? Alright, so laminar bodies produce intercellular lipids, right? Okay, there are 3 things they produce. One is ceramides, intercellular lipids. Yes, and what is the last one? You can go back and check in the notes that there are 3 things which is produced, right? Okay. How about the next one? The cement, the barrier is lost in what? Tell me. The cement barrier is lost in what? Sequelins. Sequelins is the answer for this one, right? So the third compound which is made by the laminar bodies, first is the intercellular lipids, then we have the sequelins, and then we have the ceramides. Yes, these 3 elements are being produced by this. Okay. All right. We go on to the question number 10, right? So cement barrier is lost in what? Yes. So the cement, this is not some word which is used in like ionicity or something. This is just like to make you guys just that bang on track. You know, we never get the analogy wrong. That is the reason I mentioned this. Okay, the cement barrier is lost in our analogy. It is lost in the acute eczema, right? The spongiosis thing we have. Okay, and both these questions are from the same chapter. Okay, all right. So we're done with 10 MCQs. Yes, and yeah, we have 6 more minutes to go in our timer. Okay, so from now what I will be doing is I'll be doing it quickly. All right, so fine. Okay, so the parakeratosis, what do you think is parakeratosis? Okay, so I hope you have that diagram in the head, right? Okay, fine. So what's happening in stratum basale, the keratinocyte differentiation is happening. Yes, so in this what happens is, if the epidermal turnover rate is increased to like a lot, what happens is there will be no time for denucleation. So if there is no time for denucleation, we will see nucleoli in the stratum corneum. Alright, so what is it? Big strong guys love coffee, the stratum corneum. Yes, which is there. That is the one. Yes, which has these nucleoli. Alright, so that is all for that. So retention of the nucleus in the stratum corneum. Okay, so dyskeratosis plus acantholysis is seen in which disease? The answer is the Darier's disease, right? Okay, I have not included any image in all the questions from now till like the end of the cases. I have not included any images. What I want you to do is I want that straight up memory being formed in your head. Okay, fine, I have this one and one thing, if it is there, I have this. Okay, alright, so understanding is one thing, retention is another thing. Yes, so in understanding of the fine, you can understand anything possible. Yes, but if you are only able to retain it, yes, I'm not just telling that okay fine, this whole thing is just about memorization. No, if it was of memorization, so you understand, right? Just I'm giving the example of the 11th one, that what is parakeratosis. I just explain you from the right from the bottom. Yes, so that is the understanding. Yes, but if you don't remember the word what is parakeratosis, so then even the understanding is not helpful, right? So a lot of students I've seen, what happens is they just get stuck in the understanding part, because that is the fun part. Yes, that is not that is what the brain wants to do. But the retention part, right, that is where we need the whole churning thing, that again and again repetition. We have to do the spaced repetition, right? And so many things just to get that word in our head. Yes, okay. So retention is one thing, understanding is one thing. Okay. Alright, so we go to the next one, that is acantholysis. Is what? Acantholysis is loss of intercellular what? Yes, it is loss of intercellular what? Desmosomal connections. Alright, we have those things, right? The desmosomal connections we have the primary and the secondary acantholysis. Alright, so if you remember, I made a flowchart. Yes, primary acantholysis, secondary acantholysis. Yes, and what was the example of secondary? Come on, tell me. If you remember, it was the HSV, right? In the next chapter, we'll read about extensively about the viral infections, and I made everything very simplified format. Yes, all the flowcharts are there, and all the images are there, and everything is there. Everything is waiting for us. All right, so we'll be discussing everything today itself, and yeah, so loss of intercellular desmosomal connections. Okay, that is the answer. Spongiosis means what? The edema, right? The edema which is forming, the intercellular edema which is forming. Yes, okay. Spongiosis. When the cells are not able to adhere to each other, they lose. We saw like, I don't know, 3 histopathological images. Yes, we marked this thing very clearly. We'll do it again today as well. Basement membrane anchoring fibrils are made up of dash collagen. Okay, so this question nobody should get it wrong. Guys, this is a number. Yes, so numbers, I think There are only two type of people in the world. One of the people, first category, they are like, they can't, you know, get the numbers right. The other ones are like, they always get the numbers right. Yes, so luckily I'm from the second one, so it is, the answer is type 7 collagen. Okay, all right, type 7 collagen. So I also, just for this topic, what memory do we have is, I gave you an image, right? Yes, I gave you an image, we marked everything all right, but I also provided you the reference from the Fitzpatrick textbook. All right, so that is one thing. The reason I keep telling all these things, you know, because I want you to make that connection in the head that, okay, fine, sir told this, so it is 7. When you see the answer, it is 7, 100% is 7, because your brain has 2-3 ways to go and get that information back, right? Okay, all right, so 15 minutes done and 15 questions done, so we are good, right? We're good, the speed is good. I'll increase the speed from now on. Okay, match the following. Yes, just as the kindergarten, right? Okay, so I hope everybody has filled up. Yes, I'll restart the timer again. Okay, so now we'll just try to cover up double-X the questions. Okay, so in 15 minutes we'll try to cover up 30 questions. Okay, all right, so I hope I'm sensitizing you. Start. Okay, fine. So Merkel cells, what do you think this is? Merkel cells, what are Merkel cells? So this is going to be what? Produce keratin? Do you think so? No, right? So do you remember how I asked you to memorize this one word, this touch receptor, that is Merkel cell? So whenever I see Merkel cell, only one line should come in your head, that Merkel is a name of a blind boy. Merkel is the name of a blind boy. So whenever in your life you see this word Merkel, just remember this, and your questions, I promise you will never go wrong. Concepts would be never go wrong, and you will never confuse in this, right? 2-point differentiation has been done with this. Yes, and also touch sensation. Okay, 2-point differentiation, touch sensation is because of the Merkel cell. Okay, melanocyte is what? Touch or produce keratin. What does it do? Melanocyte, melanosomes, right? It's pretty simple. Okay, Langerhans cells, what are these, ladies and gentlemen? What are these Langerhans cells? And before answering this, one thing, answer me this, that where are these found? Where are the Langerhans cells found? Spinosome, right? Stratum spinosome. Okay, all right. So these are the APCs, simple, antigen presenting cells. These are the simple ones. What are the keratinocytes? Keratinocytes, we have the last one, right? So these produce keratin. Simple. Yes. Okay. All right, fine. So we go on to the next one, that is, this is just, and from now what's going to happen is, I just have one-to-one thing. Okay, so very simple. Thickest skin is found where? Thickest skin is found where? Upper back, right? And how about the thinnest one? Thinnest one is found on the eyelids. All right. How about the next one? Rete ridges. Rete ridges, yes. Okay, so what I have written is, these are the downward projection of the epidermis. This is contradictory, right, to the word, because I just flipped the word here. Okay, what I have written in the notes, right? So how did we memorize this? It was like the roof, right? Rete ridges was the roof part. So when epidermis is going over there, when the epidermis is going the invaginations, right? These were by definitions over there was rete ridges, right? So I just flipped them up. Okay, so rather than going from the top, I went from the bottom. So downward projections of epidermis are rete ridges. Okay, papillary dermis is just loose connective tissue, so probably you may not be able to answer this. Okay, how about the reticular dermis? A reticular dermis is dense in what? Reticular dermis is dense in collagen. Yes, it's dense in collagen. Okay, so we should know, right? We all talk extensively in dermatology about collagen, and we want everybody, the whole world, there's billion-dollar industry just to stimulate this one. The tightness of the skin, the loosening of the skin, the beauty of the skin, the intactness, all depends on this. We want to stimulate this by diet or vitamin C. We do endless amount of things, right, to stimulate this one guy, that is collagen. All right, how about this one? Dermis, what is the major cell? Come on. Who is the major cell of the dermis? This is the fibroblast, right? Fibroblast is the major cell. Okay. I hope you did not say some other cells. Okay. All right. We just leave on to that. Okay. How about the section 2? We're done with section 1. We're done with the complete introduction of dermatology. Okay. Now we'll go on with section 2. Okay. So now the questions would be like, not that easy as before. Okay. Little bit twisting over here. So first of all, the question number 30 is Munro's microabscess is formed by. I'll add one more question here, by what cells and where? Alright, so it is by neutrophils in stratum corneum, right? I hope you guys remember the image. So image pointing is very important. We did it, yes. If I give you histopathological image, so image I have not included in any of this. Why? Images will be discussed separately in the images video. Okay, so we'll make up the whole combination of all the derma images and we'll try to just go. It will be sort of a revision as well, right, for us. Okay. Pustular psoriasis flares occur after what? The most common cause I'm only asking, I'm not asking you like to give me the list, yes. So the answer is sudden stoppage of steroids, right? Okay, the answer is sudden stoppage of steroids. So steroid withdrawal would be the answer. How about the next one? Most severe psoriasis variant is what? Most severe psoriasis variant is what? The answer is something more than 90%, right? Erythrodermic psoriasis. Okay, so I hope you have that image in the mind. Okay, I hope you have that image in the mind. We drew like the whole thing, about psoriasis, different types, right? So pustular, guttate, the raindrop one, the nail psoriasis, all the, if you remember that, whenever you have the psoriasis topic, just try to, make that thing, like you will never go wrong in psoriasis then. Okay. This is erythrodermic psoriasis. Okay, so the next question is, salmon oil drop sign in the nails are seen in what? So I think it's very easy because I just touched that topic, right? So, but if this question is given to you independently, you should be able to properly answer that, right? So salmon sign is seen in psoriasis, yes, nail psoriasis, which is there, we seen that. Okay, all right, the hyperkeratosis part is there. Okay, so I hope you remember, you see that image. Yes, you remember that image. Okay, so okay, so but whenever you see an image, right, so don't memorize the image. Okay, don't memorize the image, memorize the finding. what we are seeing. So drug of choice for pustular psoriasis, what are you going to give? Acitretin, right? Acitretin is the answer. We'll give acitretin. Okay, so the most accurate diagnostic biopsy finding, yeah, this is a good one. What is it? Please mind that biopsy finding word. Okay, I'm not asking anything else, I'm asking the biopsy finding. Okay, so suprapapillary plate thinning. Okay, suprapapillary plate thinning. So this word is not like out of the world. Okay, so we have this in our notes. Okay, so alright, fine. So we're done with till question number 36. Now we go on to the next one, right? So the chapter is same. Yes, the chapter is same. We are reading about psoriasis. How about this one? So 𝗲𝗵 sign. What do you know about 𝗲𝗵 sign? Yeah, so what I wanna ask is the bleeding, right? The bleeding aspect. So it's gonna be pinpoint bleeding. Okay. Next one, 𝗲𝗵 phenomena. How would you define a 𝗲𝗵 phenomena? Simple. The lesions which appear after the trauma. Yes, there is some trauma happening, maybe some scratching or any XYZ cause. Yes, so that is 𝗲𝗵. So what would be pseudo-𝗲𝗵 phenomena? Yes, something like we eliciting those sort of conditions, but it is not because of trauma, it's because of some other thing. Okay, could be because of self-inoculation. Yes, okay. Example, molluscum contagiosum. Okay, the next one is psoriatic arthritis. So this is a very important one. Okay, I want to know the criteria. What criteria we use for psoriatic arthritis? 𝗲𝗵 criteria, right? 𝗲𝗵 criteria. Okay, so all these things we should know very clearly. All right, fine. The next one, penicillin cup deformity is seen in what? Obviously, if we are doing psoriasis, so yeah, it is psoriasis. So it is psoriatic arthritis. Okay, it is psoriatic arthritis. All right, yeah. Okay, fine. So some case-based questions, these are not the one that I mentioned. I have separately 10 cases at the very end. Okay, these are the easy ones. Patient develops confluent generalized erythema covering more than 95% of the body surface area. What is the diagnosis? Yes, so I hope everybody is right. Yes, it is erythrodermic. Yes, erythrodermic psoriasis. Okay, fine. A pregnant woman develops pustular psoriasis. What is the condition? So the condition is, this is very important to remember, right? Because there is an exception in it. Okay, that is the reason I mentioned there is an exception in it, and also this is a misnomer. Two things. So the diagnosis would be 𝗵𝗵𝗵𝗺 herpetiformis, but this is nothing related to herpes. Okay, herpes we will be reading today, and you will know everything about herpes. Yes, first of all, the classification is very important in herpes. Leaving that, drug of choice, what you would do. And one more question I want to ask, how would you manage flare-up reaction in psoriasis? Yeah, two questions. Yes, so I hope you got this right, and if not, it is absolutely fine. The answer is, to manage the flare-up reaction, we would give cyclosporin. Yes, and 𝗵𝗵𝗵𝗺 herpetiformis, this is the only condition where steroids are indicated. Rest, everywhere steroids are contraindicated. Okay, alright, why they are contraindicated? The answer is that it can elicit, right? It can elicit pustular psoriasis. Okay, alright, fine. So it is absolutely contraindicated to give steroids in other type of psoriasis except 𝗵𝗵𝗵𝗺 herpetiformis. Okay, so let us go on with the section number 3. Okay, so we do have about 2 minutes remaining, right, from the previous session. Okay, so 𝗵𝗵𝗵𝗃 are due to what? Hypergranulosis, right? So one area in the skin, it is being proliferating a lot. That is the reason we have these ridges and we have this striae. The reason for striae is the hypergranulosis. LP is mediated by what? Lichen planus is mediated by what? Who is responsible for it? T cells, right? T cells are responsible, and in the T cells, CD4, CD8 are the one who are responsible for the lichen planus. CD8 T cells, yes. Oral lichen planus, yes, can be potentially malignant or not? What is the answer? Oral lichen planus can be potentially malignant or not? If you see a patient, he comes to you, then he says, like, you diagnose the patient that, and you see there is some findings, so how would you say? Okay, no, nothing, it is benign or malignant? Yes, right, it can go malignancy, and it can undergo malignancy. Okay, so we have to be very careful with that. Yes, Basal Cell Carcinoma, we have to be very careful. Okay, so a quick recall session. Yes, so lichen planus nail finding is what? A lot of findings, but the very peculiar one, yes, the pterygium, right? The pterygium. Okay, pterygium. And lichen planus scalp forming what? What is the name for that scalp? Lichen planoplanaris. Yes, that is the answer for that. Okay, lichen planus shows dash on biopsy. What do we see on biopsy? Rete ridges. Yes, so we have this sawtooth rete ridges. Okay, we see this. So even in our discussions about lichen planus, we discuss about this. Yes, the next one is the basal cell necrosis is formed. Yes, what bodies? Basal cell necrosis form which bodies? Timer is done. Yes, civet bodies, right? Civet bodies. So some words, like we should never forget about the chapter lichen planus. One word that is, yeah, 𝗵𝗵𝗵𝗃 and everything. Everybody know this. Everybody know this point. But these civet bodies, and these sawtooth rete ridges. So these are the ones who are very classical ones. Okay, you should know it. So let me put one more timer on. Okay, and we'll get on with that. Okay, fine. Okay, we're done with that. So chapter number 4 is section 4, that is Pityriasis Rosea. Yes, so we have about 9 questions to that, 9-10 questions. So first of all, yes, I mentioned that word here, but what is the first one to see in this condition? Yes, herald patch, right? So we see an herald patch. So I hope you can imagine that central clearing, peripheral crusting situation. You can properly imagine that, right? Okay, all right. So it is associated with what virus? So we will be reading about this topic again. Yes, and in STDs it will come again. Okay, so it is HHV 6 and 7. Alright, 6 and 7. Okay. Distribution on the back I'm asking, not on the front, I'm the back, and I'm asking what distribution do we see? Christmas tree pattern, right? This Christmas tree pattern, yes. So the images are coming on the next chapter, alright, about this one. Okay, alright, okay. It resolves after what? It is an auto, it resolves by itself, okay. How many weeks? It takes about 2 months, right? About 6 to 8 weeks, 2 months it takes, okay. Self-resolving condition. Okay, fine. So bacterial infections, we go on real quick. Yes, so in impetigo, alright. Yes, so what do we see? I am asking about the very classical one. Okay, I know there are 2 types we discussed, the bullous and non-bullous. Yes, okay. So the honeycrust lesions, right, are seen. Okay, in bullous impetigo, right, the toxin, yes, toxin, that I have framed this one a little bit different. Where does it act? Toxin, where does it act? The desmoglein 1, right? Okay, desmoglein 1. This is where it acts. That is the whole thing. Okay, staphylococcal scalded skin syndrome. Yes, does it have a positive or negative Nikolsky sign? It is positive, right? Okay, 𝗲𝗵𝗵. How would you define 𝗲𝗵𝗵? First of all, see, these terminologies are very important. Okay, so you cannot afford to forget it and make it wrong. Okay, have that image that I think, yeah, it was an image of an old person. Yes, in our notes itself, we had these very ulcerated lesions. Yes, and if we take out the active lesion, yes, and at the very bottom we would find the crusting. Yes, okay, that is what the answer is. Ulcer with thick adherent crust. Okay, ulcer with thick adherent crust. How would you define a carbuncle? Carbuncle, furuncle. 1 hair involved, right? Okay, carbuncle, 1 hair involved. Yes, yes, answer is wrong. Okay, in carbuncle, a group of hair follicles. Yes, in furuncle, only 1 hair is involved. Okay, alright. Multiple coalescing furuncles. Okay, Corynebacterium 𝗲𝗲𝗃. Okay, so I want to ask the Wood's lamp finding. Yes, I want to ask the Wood's lamp finding in the Corynebacterium 𝗲𝗲𝗃. Pretty simple, yes. So because whenever we just hear about the wood lamp, there's only one name coming in the whole of our head, that is coral red. Yes, that is one color that is there in our mind. But in our list we discussed about 6 to 8 type of different colors. Yes, and the colors is imparted by what? Porphyrins. Yes, the answer is porphyrins. Okay, so go on with real quick. This is the question number 106. Okay, so we are doing things pretty fast. So Pityriasis versicolor. So what are the 𝗘𝗵 finding? The delicious spaghetti and meatball appearance, right? Okay, fine. Yes, that is that. And the next one is hypopigmentation. So one question, in Pityriasis versicolor, do we see only hyperpigmentation or only hypopigmentation? We see both, right? The answer is both. Okay, so the hypopigmentation is because of what? It is because of azelaic acid, right? That is the one, that is the answer. Yes, so it inhibits the tyrosinase, yes, in the melanocyte production. Okay, alright. Everything is there in our notes, nothing new. Okay, fine. So the tinea capitis, the grey patch, is microsporum, and we would use graziofulvin. Okay, in the black dot tinea, trachophyton and terbinafine, we would use it. Okay, and chirion, how do you define chirion? Boggy swelling, right? Boggy swelling. Okay, tinea unguum, what is the drug of choice in tinea unguum? Terbinafine, right? Terbinafine is the answer. Terbinafine. Alright, so the section number 7, the viral one. Okay, so soon we will be doing up with till question number 140, and the last 8 questions, these are the case based questions that I have. Okay, alright, fine. So in the HSV cytology, what do we find? So many questions I have with this one. First of all, let me ask my questions. Okay, first, what type of acantholysis is that? Secondary acantholysis. Okay, I hope you have that image memory in the head, that page is coming on to your mind. Yes, over here we have primary, here we have secondary, and in that, where is the problem? Where do you think is the problem? In the secondary, what differentiates primary and secondary? The answer is desmosomes, right? So in primary, the desmosomes are the ones who are getting destroyed. The intercellular connections are being broken. Yes, and in the second one, what's happening is these are all right. Yes, but the problem is in the keratinocyte. Okay, that is the reason. Yes, what is happening is we see multinucleated giant cells. So that is the answer to that. Okay, all right. So I hope you never go wrong with this one small topic. Okay, all right. So varicella zoster virus. Yes, in this one, yes, the lesions are described as what? We'll be reading about this again a lot of extensively. We'll be reading about so many things. Yes, so I know this chapter is going to come. Yes, and I have not taught you yet, but still, okay. The answer is dewdrop, right? The red dewdrop lesions we see. Okay, that is the rose petal type. Okay, in molluscum contagiosum, introduction of dermatology, we covered a lot of things. You can answer few things from that. When molluscum contagiosum, yes, so how would you describe the papules? Umbilicated papules, right? Umbilicated papules. Yes, so molluscum body name, what is the name, right, in that? HP bodies, right? Henderson-Peterson bodies. Yes, that is the answer. Okay. Herpetic vitilo, right? So is seen where? So these questions from 136 to 142, I am not. If you make them wrong, it is okay. If you know, it's fine. It is. If you don't know, it's also fine. No worries. Okay. We will be reading today about everything. This viral infections, we will do everything with this. Herpetic vitilo, yes, affect what? The stomach area or face or nose or lips? No, right? Fingers. Okay, vitilo is for fingers. Reactivation of varicella zoster virus. What does it happen? We have the shingles, that is the herpes zoster, right? And this question is very, very, very popular. Very, like, we should know this one. Yes, so what are the complications of the herpes zoster virus? What are the complications? How to manage this? And everything we should know about this. Everything we will know. We'll read about everything today. The complications are the post-herpetic neuralgia, right? So even after everything is done, the treatment is done, what is going to happen is the patient will have pain in the affected nerve. Even though the lesions are subsided, in case the patient is having herpes labialis, even if it is subsided, so what is going to happen is the patient will have pain in that area. Okay, all right. Now these are the questions, right? These are the integrated questions that I made. All right. So first of all, these are the ones which are tested nowadays, right? So everything is clinical and stuff. As we know, this word is buzzing around our ears for, like, I don't know, forever. But it's good, yeah. So because I think these are the questions which are most easiest to answer, right? Because so much information, yes, and so many things you can, like, pick up from, yes. And over here comes the concept of buzzwords. Yes, so do you know the buzzwords? Yes, so if I'm telling you, for example, I'm telling you there is increase in epidermal turnover rate. It is very specific, so everybody will know it is psoriasis. But if I give you a nail finding, yes, and the nail itself is a big chapter, right? So if I give you just image and I don't tell you this, yes, now the question becomes a bit complicated. Yes, simple question like psoriasis could go wrong if you don't know these buzzwords. Okay, so what we have to do is we have to train our mind in very specific format. Yes, even though when solving this you may feel that the questions are very simple, but my objective is not to train you for the exam. My objective is to train your brain. Yes, so whenever we read a topic, what are the areas we should see and how to apply in the clinical aspect. Yes, so it is just about our education system, right? So whichever country from where we are, whatever it is, we are designed to give exams, right? Our life is all about exams. We are defined, our existence is defined by how many exams we have passed. But that is not the case. A person could be extravagantly successful, having great ranks, but he could be a very bad clinician. Yes, and a person could be a very good clinician but could not have performed really well in this exam. Two different aspects. Yes, but we are doctors. Our job is to get that diagnosis right. Yes, so we have to treat the patient. Okay, how to do, what to do, this is what we are reading about. Yes, it is all about, our life is about that. Yes, alright. So let us just start with the integrated questions right up. First off, a 42-year-old male presents with chronic scaly plaques over the elbows and knees. He also complained of pain and stiffness in DIP joints, and there is redness of eyes. X-ray of hand shows pencil in cup deformity. Okay, lot of buzzwords here. First of all, what do we have it? I know you won't have a luxury of a pen in the exam, but you have your eyes. Pencil in cup deformity. Okay, chronic scaly plaques. Yes, okay, and there is also one eye finding. Yes, there is an eye finding in it. Okay, all right, we have that. So this is a topic of psoriasis. Okay, so this is a topic of psoriasis. So the likely diagnosis, to answer the first one, this is psoriasis. So I should write it, it would be better. Okay, alright, this is psoriasis. Fine. And what now, you see, in one question I put 4 questions. I did not put 4 options. Okay, I want to cover the topic. Yes, I don't want just to answer the question, I want to cover the topic. Okay, HLA association, tell me, read the question again. You know, he has stiffness in DIP. Yes, so HLA-B27, right? HLA is, this answer is okay. All right, that is the one. Okay, what about the next one? Likely eye involvement. What part of eye is being involved and what does it elicit? Okay, all right. Anterior uveitis. Okay, see, the question says he also complained or redness in the eye. So this is layman term. Okay, doctor, I am having some redness. So you know that this is a case of psoriasis. Yes. So what part of eye should be affected? Would be affected? Anterior uveitis. Yes, anterior uveitis. Okay, what do you do to treat? Yes, extensively we discuss about the treatment, but the main thing is to control the immunity. How do we do it? By the best results are by methotrexate. Okay. Okay, methotrexate, these are the best results with this one. Okay, moving on to case number 2. A 24-year-old male uses OTC, over the counter steroid creams, for itching, ring-shaped groin rash. Now the lesions is enlarged, shiny, less scaly, with satellite lesions. Okay, so what is the diagnosis? First of all, the diagnosis would be tinea. Alright, the first thing is tinea. Okay, fine, but you see there is a history given here that there is an over the counter steroid cream usage. Okay, the person thought he has a doctorate degree. Yes, and he just thought of treating himself, and he ended up in a worse condition. Yes, why? Because of this is a new topic, right? In tinea we read, yes, the answer is tinea incognito. Yes, so the diagnosis is tinea incognito. Yeah, pseudomedicos was the word I was thinking about. These are the pseudomedico people. Okay, all right. So why did steroid worsen it? So what actually happened? Why did we had this condition? So okay, fine. Like if there is some fungal infection, the steroid should be treating it, right? So why did it not happen? That is the question. Okay, so it decreased the local cell immunity, right? That is the reason it had. So it decreased the immunity of that particular area. That is the reason the whole mayhem happened in tinea incognito. Okay, what do you do for the best treatment? Give oral steroids? No, right? You would give antifungal. Okay, you just give a very regular tinea treatment. You know, we'll just give fungal treatment, and it should be fine. Alright, so we're done with the case 2, now with the case 3. A 55-year-old chronic smoker has reticulate white lacy lesions on the buccal mucosa plus violaceous papules on the flexures. What is it? What is it? Lichen planus, right? Very simple question. Very simple question. I did not put a very big history with this one. So very simple, like reticulate lacy pattern. More of it is this, the violaceous papules on the flexure, right? So purple, yes. Polygonal flat top lesions, yes. This was the sentence I made you guys remember in the chapter. Okay. Diagnosis is lichen planus. Okay. Histopathological hallmark. I'll add one more question. What is the histopathological hallmark, right? So we this question just came just now, yes, in our quiz. What is it? Sawtooth ridges, right? Okay, sawtooth ridges. Okay. What are the necrosed bodies called as in this? This is another question not listed here. Necrosed bodies are called as what? Cement bodies. Okay. Please do not forget this. Please do not forget this. Okay. All right. This case, like every word is just put it in the head for forever. Okay. Long-term complications, ladies and gentlemen. What is it of the oral mucosa I'm talking about, because that is about the presentation of this patient. Yes. It is cancerous or not? Precancerous or not? It is pre-malignant, right? Okay, fine. So it can cause squamous cell carcinoma. So simple. The next one, the case number 5. A child has eczema with a family history of asthma. Skin is dry and itchy with lichenification on the flexures. Okay, interesting, very interesting. What do you think is the diagnosis? Yes, so one more thing I can give you, the age of the child. Yes, so if you have raised the diagnosis, well and good, no problem. But I just want to help you. One hint, the age of the child is less than 5. Yes, now I think there should be some bells ringing in your head, right? Okay, the answer is atopic dermatitis. Yes, so we covered this topic 2 to 3 times already. Okay, now we are revising it again. Okay, so the age of the child is less than 5. Okay, that was the hint I given you. So it is atopic dermatitis, eczema. All right, and you see this history of asthma. The history of asthma, this is the point which was overlooked even by me. Even by me, when I used to read about eczema. Okay, fine. It's just some crusting on the skin, and we just gave some moisturizers, and we're good. Nothing to worry about. But you see, if you know your theory right, you could never go wrong. The diagnosis would be so easy to make. Yes, so the answer is atopic dermatitis. Okay. All right. So what is the protein that is mutated is? Tell me. This is again a repeat thing we had. I just put this question again. Filaggrin, right? Filaggrin. Skin barrier defect type. What is it? The epidermal layer is gone, right? Okay, epidermal layer is gone. That is the reason they are prone to which infection? Tell me. Remember the diagram? Yes, remember the diagram? Secondary skin infections, right? Obviously, because now the barrier is gone. The skin barrier is gone, so anything can penetrate. Yes. Okay. Treatment strategy, ladies and gentlemen. We would just give moisturizers which has what? Cement, we need cement. Yes. What does cement has? It has ceramides, sequelins, and intercellular lipids. Yes. Made by whom? Made by keratinocytes, lamellar bodies, Orland bodies. Okay. So I hope I have hammered all these points in your head very crystal clearly, and you can never go wrong in this topic. Okay. Alright, so we just gave that thing. Okay, skin barrier type. Okay, fine. Okay, cool. We can move to the next one. Case number 6. A child presents with boggy, painful swelling of scalp with pus discharge and regional lymphadenopathy. What is it? Boggy swelling, I think 1,000,000%, like everybody would go right. Boggy swelling, chorion, that image we discussed, right? The chorion, the exudative pus which is there, okay, on the head. All right. Painful swelling of the scalp. All right. So we have that. Diagnosis would be what? Chorion. Don't expect that I will put on images. Images will be discussed separately. Now this session is only about pure memory retention. That is the point of this. Can you memorize the hot words, or is your brain receptive to the hot words? Yes, and all the clinical findings. That is the point of the discussion. Chorion, right? So which fungus? Most likely fungus is what? Trichophyton, right? Trichophyton. This is Tinea capitis. Most likely fungus, what is it? This is the Trichophyton mentagrophytes. Trichophyton mentagrophytes. What is the treatment for it? Yes. How would you treat these patients? Yes. What would you do? We would give oral terbinafine and what? And 𝗲𝗵, right? And okay, either one of the two we can use. Case number 7. All right. These case number 7, 8, 9. These are from the chapter viral infections. Okay, but still, I'll put this on here. Pregnant woman develops chickenpox in 3rd trimester. All right. Which antibody protects the fetus? Tell me. It's general topic, right? It is general question. It is not like a very specific related to dermatology. Yes. Which is it? IgM or IgG? Maternal or fetal? Maternal IgG, right? Yes. Second question. If exposure occurs near delivery, newborn gets what? Definitely newborn is going to get the virus, that is the varicella virus, but this will be a neonatal varicella, right? So we'll be reading about 2 types. Yes, one is the congenital, one is neonatal. All right. In here the duration is very important. Okay, we should know the duration. If you know the duration, that is the point from this topic, that okay, fine, we know the topic. Yes, that is it. That is neonatal varicella. Okay, that is for this. Okay, treatment. What do we do for treatment of the newborn? We would just give the IVIG, right? We would give the varicella immunoglobulins. Yes, we would give the immunoglobulins to the child directly so that he can counterbalance this viral load. Okay, all right. Case number 8. A child has widespread skin peeling, tender erythema, fever, 𝗏𝗏𝗏𝗏 sign, and there is 𝗏𝗏𝗏𝗏 sign is positive and there is no scarring. What do you think? Yes, peeling, erythema is there, fever is there, 𝗏𝗏𝗏𝗏 is positive. What do you think? There is no scarring. Answer is simple, right? So this is SSSS. So staphylococcal scalded skin syndrome. Yes, SSSS. All right. Causing toxin acts on which protein? Yes, which protein does it act on? Yes, we did just right, DSG1. Okay, blood culture result. What do you think is the blood culture? Is it positive, negative? Yes, it is typically negative. Okay, because this whole condition is what? Is it systemic or what? This is the very important point we should know here, right? So if you know this point, that why is it negative, so you have understood this topic very well. Yes, so the mayhem is because of the toxin, not because of the bacteria itself. Okay, all right. So if you know it, that there is one focus. For example, there is otitis media, and from there is the whole systemic spread of this, right? Systemic spread of the toxin. That is the reason we have all these lesions and all this presentation of this disease. Yes, okay, all right. So if you get the question number 3 right, now like it is just perfect. Okay, all right. Case number 9. An atopic dermatitis patient develops clustered, painful, punched out erosions on the face. What is it? All right, so you may know this, you may not know this. It is absolutely fine either ways. Yes, this is eczema herpeticum, right? All right, that is the one. Which virus is the one who's causing it? It is HSV1. Drug. What you would give, so it is viral etiology, right? So we just have this 𝗖𝗵𝗶𝗴𝗺. Okay, all right. Question number 10, right? The case number 10 we have here, that is teenage patients present with multiple oval salmon colored plaques along the ribs with one large lesion preceding others. What is it? All right, so the answer is pretty straightforward. Yes, we did discuss this about 2-3 times already. So what is the name of the first lesion? That is the Herald patch, right? We see. Okay, and what is the name of the pattern? Yes, we see on the back. Yeah, this is Christmas tree. Christmas tree appearance. Okay, it's like downward falling thing on the back. Today we'll see the image as well for it. Treatment. It is a pretty self-resolving conditions in how much time? This is about 6 to 8 weeks. Yes, so it is self-resolving condition. All right, fine. So that was all about the quiz time. Yes, so so this was like a 𝗲𝗵𝗵𝗴𝗺, right? And I forgot to put this up name, in the very end. I guess I got pretty excited about the session. Okay, so it was a 𝗲𝗵𝗵𝗴𝗺. Yes, in Chinese we see, right? That is the exam time. All right, fine. So I hope that was good for you. Yes, all the questions that were there were straight from our notes. It was designed to have a proper memory retention, yes, of all the videos you have seen so far and all the notes that you have read so far. All right, so now we can do is you can proudly add in your stars, yes, in your my limitless star section. Yes, so you can go in and add there and you can be very proud of yourself. Yes, and I hope you're not cheating on yourself. Yes, that they get that pseudo confidence, just let us just mark it up a bit more and we'll be happy. No, we have to be true to ourselves. Yes, okay, all right. So we will be conducting these sort of sessions more, and once we're done with 3-4 chapters, I'll plan a session like this. Probably you can just listen this up like in a faster speed. Yes, that is also fine, works absolutely fine. If it works for you, it's absolutely good, right? Okay, all right. So that was all about the quiz time. Thank you so much for listening.